I'm so happy to have a chance to sit down and have a conversation with you. It was so fun to have you on the panel for the M Factor screening after all these years.
The best part was just reconnecting with you.
Right, absolutely. Like, I think we worked together 7 years ago. I can't even remember exactly the date. Yeah.
Yeah, I don't know. I don't remember.
So long ago. But it was in the early years of Menopause Chicks.
Yeah.
And when I reconnected with you, I was just so pleased and inspired by everything you've done with it over the years and how it's really become such a space for women to share their journeys in this time. And so that's super exciting. And the kind of traction that you're getting as well in terms of like, I mean, in the corporate space, but also I've also seen you in the media. So yeah, maybe we can talk a little bit just to have a chance to introduce yourself a little bit more about that journey and yeah, what brought you here today, I guess.
Oh gosh, yeah, so many roads brought me here today, actually. Well, we both live in British Columbia, and I live in Port Moody, BC. I'm almost 58. I reached menopause when I was 49. I never in a million years thought I would grow up to be a menopause chick. This was not on the bingo card. But when I started to experience things that I needed to get really curious about with my health or pay attention, one of the first things I noticed in my own research and my own journey was the lack of conversation, the lack of information, and also all of the confusing messages for what was out there. It wasn't clear for me, if this, then that. And I had young kids at the time. And so we were doing all of the other conversations as parents do with young children, like, they were getting their education at school and we were augmenting that at home. And I thought, there's got to be like an easier way. And so, fast forward, I've been doing this work for 12 years. I love what I do. I love that I can bring knowledge transfer to women and to a community of women who are, in many ways like me, getting curious, trying to prioritize their health. Maybe they even have some concerns that the healthcare system won't be there for us when we need it in a year or a decade or two from now. So, a whole bunch of things can bring individuals to these types of conversations. But really, menopause is on a mission to make sure that women have quality evidence-based information so that they can feel empowered and confident making their own health decisions. And that remains unchanged and will remain unchanged going forward as well.
Yeah, so that's really your mission, the filling that knowledge gap and that for women, but you don't recommend any particular approach. Like, are you kind of agnostic in terms of approaches, or do you lean
So,
towards, yeah?
I mean, that's interesting because some people will probably think I do recommend things, but really it comes back to you are the driver of your own health bus. And so my job is, it's multifactorial. One is I will always share my own journey because I think we learn a lot from looking to someone's story
Mhm.
as opposed to a medical article or a doctor's visit. That might not give us everything that we need. We want to hear stories from other people like us. And then the second thing I do is that I have studied extensively over the years with the Menopause Society, the International Society of Gynecologists, and surrounded myself with many practitioners who were just so kind and generous with their expertise. And I will always take that information and translate it for women so that they can be like, oh, so this is what that information means for me. Because
Mhm.
science is one piece of the pie. We need that. We should probably start there with questions like, what does the science say? But there's always nuance laid over top of that.
Mhm.
Age, stage we're at, other health conditions, other medications, whole bunch of things. So all of our Rubik's cubes look differently. We're all unique, right? And so I think it's really important to be like, here's what the science says. Here's the guideline. Now you can take this forward and get curious about these two, three areas.
So you bring in a lot of that knowledge, those conversations you've had, the privilege to have with the experts, because as I think one thing that came up in our discussion and in the movie is the lack of formal education that even doctors are getting on this topic. So in a way, doing your own detective work and gathering all that information makes you potentially more of an expert than a sort of a general doctor who hasn't had any of that training.
Yeah, I mean, that is hopefully changing. But even, the very best, I think what we need to understand, what women need to understand, is that even the most formally trained doctors can help you take the options that are available on the menu, help you weigh the pros and cons, but the decision is yours. And I think this is a very interesting, nuanced piece of
Mhm.
our society, if you will. And here's an example that comes to mind. So sometimes women they'll say to me, my doctor put me on X. And the very first thing I have to say is, actually, you chose that therapy, right? And it kind of like it changes this dynamic
Mhm.
the conversation. But if you choose a therapy, it means you can unchoose it, or it means that you can go back and tweak that. But the power is in us. And I don't want to like go on and on about that, but it's really something that's quite important because in other areas of our life, let's say our financial life, for example, I mean, you might get mad at your financial planner for doing something or recommending something, but they don't do anything without your signature, your stamp of approval.
For sure. It is a bigger conversation about our, the way we've sort of given our power over to the white coats and the health care
That's
and how a lot of us feel very disempowered in that process. And, and so, and a part, and something I advocate as well as a health coach, it's
right.
all about taking the power back and taking responsibility for our choices.
Well, or
Right? Yeah.
evening out the power, I would
Hmm.
say. So if the white coat situation
Mm.
is that women feel disempowered, I want to level it. I want it to be a partnership because white coats play an important role in our health. But having women not feel like they have agency to feel informed, choose confident when they're making their decisions, I think that that's put us behind the eight ball in this menopause conversation for sure.
Right. I mean, in a lot of health conversations, I see that in other areas as well, in terms of understanding the processes, of our bodies that lead us to the approach of, the kind of medicine I practice, functional medicine. Going to the root cause is understanding that disease is a process and taking kind of responsibility, not in a blaming way, but just to
No,
say,
no.
yeah, in a sort of responsibility to and seeing that it is a process. So the good news is that I can intervene at any point. I don't have to wait until a diagnosis to be like, okay, now I'm going to handle this. But in the context of menopause, I think definitely, apart from pregnancy, anything kind of hormone, menstrual cycle related for women is not really part of the conversation. Like if you think about how many times have you spoken about your period, anybody, right? Or your friends or anybody. So it's not surprising that when it comes to menopause, all of a sudden, it's a conversation that hasn't been happening, right?
Exactly,
Mm.
exactly. And conversations haven't been happening and connecting the dots, the implications, those conversations have not been happening. So
Hmm.
we have lived for decades with women having the highest rate of heart disease and stroke. One in three of us falling and breaking a bone due to osteoporosis. 100% of us experiencing changes to our genitourinary health. And yet, we've never connected the dots for individuals back to this is how your hormones work when cycles are regular. When cycles are no longer regular, you are now going to be at risk for these things.
Hmm.
So, the fix it culture or medical community, science has really done a great job in terms of we have a problem, here's a solution. And we've tested it and it works. But we haven't yet done that job of connecting the dots of saying, if this, then you've got to make a plan for that.
Right. And oftentimes our hormones being less regulated in this time of life reveals deeper imbalances that are addressed because as our hormones being connected. And so it's our whole health. We're not just talking about reproductive health here, right? Yeah.
Yeah, and like that was definitely some of my early learning. I'll be honest with you. When I started Menopause Chicks, I did not know that I would be talking about bone health every day. I hadn't made that connection. And if we want to bring it back to the movie, the
Yeah. Absolutely.
documentary, they talk about oral health or dental health. There's a part very early on in the documentary where they talk about like women will lose at least one tooth or something like that. And I was like, okay, I get sort of the shock factor of putting that out there, but we still didn't connect the dots very well on the fact that what we're talking about is bone health. You
Mhm.
know what I mean? So
Right.
why is your tooth falling out? Well,
Right.
because, as estrogen declines, our bones become more brittle. And if we don't have a bone strategy in place, i.e. nutrition, strength building, and maybe hormone therapy, which are sort of the three-pronged bone health, you're going to be at greater risk.
Right. Right. So what would you say when it comes to you, comes to the community, that, I'm having all these symptoms, I'm not understanding them, or things are coming up, and, where do I start, Shirley? Like, what would you say is the journey?
Well, I usually clarify some definitions just to make sure that everybody understands because language can be very confusing in this space. We say menopause, but we might mean perimenopause or we might mean postmenopause. We also talk a lot about how it's all about your period. So you haven't reached menopause if you haven't had a period for 12 consecutive months. But that's not what
Hmm.
menopause is.
Hmm.
That's just the temperature gauge. Menopause is the end of ovulation. So your
Right.
body is ending its reproductive life stage. And then what are the implications of that? And then the next place we go is we must learn the roles and responsibilities of our hormones, primarily estrogen and progesterone, but I like to stretch it out and include cortisol and thyroid because, changes in those areas have huge health implications as well. And the reason why I'm such an advocate for that is because you pick up your phone right now and look on Instagram in any way, shape, or form, you are going to find a really long list of somebody saying there's 32 or 47 or 68 symptoms of menopause. And I'm using air quotes right now because I don't say symptoms of menopause.
Hmm.
And it's like every adverse health experience a woman has gets tossed into this bucket that's labeled menopause. Meanwhile, she might have a thyroid condition. Her hair might be falling out because she's iron deficient. She's been bleeding heavily for years and no one ever tested her ferritin. Like all of those things. So if you take it back and you actually understand, oh, progesterone is responsible. I'll just give the top three now, but it's responsible for my mood, my sleep, and protecting the lining of my uterus. Okay. So my hair falling out is likely not a progesterone problem. Okay. Like, and you can kind of go through the list. Estrogen is responsible in addition to, helping develop an egg. It's our juicy hormone. So it keeps our skin and our eyes and our mouth and our vaginas lubricated. I'm experiencing vaginal dryness. Oh, I wonder if that's an estrogen problem. And it just really helps us, I hope, quickly discern what it is we need to address and get curious and talk to our health teams about.
So it's about kind of connecting those dots. Yeah.
The
And
dots.
understanding that things are connected. And
Well,
yeah.
and the worry for me from a sort of social construct space is that how many women right now are blaming menopause, I'm using air quotes again, for something that if they understood the root cause, it could be easily treated for them. They could go back to enjoying, quality of life and vitality.
You mean rather than saying, oh, it's menopause, so I somehow have to live with this?
1,000%. I mean, I don't know if there is
Mm,
such a thing as 1,000%, but yes, how many women are not sleeping and haven't slept
mm,
well for decades and are saying it's just menopause?
mm.
How many women have been losing hair for, 10, 20 years and say it's just menopause? We can do better.
Yeah, actually, I had somebody comment to me after the screening event that she'd had a burning tongue for a while and
Yeah.
went to see a bunch of doctors and just made the connection during that movie that, hey, that could actually be something to do with estrogen levels or yeah.
Oh, I hope
Yeah.
she gets a solution. That's
And now
amazing.
she can get a solution for
Yeah.
that. Yeah. But yeah, going back to that, yes, there are symptoms that come from our sexual hormones, but that have deeper roots. And that sometimes you have to go a little bit deeper to, we talked about cortisol, insulin. So I know you and I both talk about the hormone pyramid, but
Yeah.
you've inverted it. So I'd love to hear what you think about what's your take on the hormone pyramid?
Well, I thought I created that hormone pyramid. I did it because there were so many conversations in the menopause community that were kind of similar to what you and I just have talked about in the last few minutes.
Right.
Often the leap that individuals will make in their mind is, oh, okay, Juliet and Shirley have finally convinced me I need hormone therapy. And they jump to this conclusion that hormone therapy will be a magic wand. And there's a whole bunch of
Right.
things that are wrong with that assumption. I am on hormone therapy. I'm an advocate for everyone getting curious about the benefits for them of hormone therapy. Let's just say that. But if the root cause of why you're not sleeping is that your cortisol is spiking at 3 a.m. when it shouldn't be, or you have a thyroid condition and that's contributing to your hair loss or your fatigue, then estrogen therapy and progesterone therapy isn't going to fix that. And so I wanted to create this inverted pyramid so that at the top, the widest part was the lifestyle factors, eat, move, and sleep. Can you look yourself in the mirror and ask yourself, am I genuinely paying attention to how I eat, move, and sleep? I wasn't. When I started this journey, those were like way on the back burner. And the next level of the pyramid is stress. And arguably that could be in the top tier as well. But it's just a way to ask yourself questions about what could be contributing to how you're feeling. And
Mm-hmm.
then the next level is, am I missing anything nutritionally? And I hope I talk about this more this year because I know that a lot of people on social media are, you need supplements, you don't need supplements, and they generalize it so much. And instead, what I love to do with women is like, if what you are experiencing is a symptom of iron deficiency, then you need to supplement with quality iron, or maybe it's vitamin D, or maybe it's magnesium, or maybe it's something else. And that's not my area of expertise, but definitely my area of expertise is to convince you that you deserve to find out if you could benefit from supplementing your nutrition, right? So, am I missing it? And then other health conditions. So, I think as women, we often are overlooked. Our symptoms can often be overlooked because we are women. And I know that that's a huge statement for me to make today, but thyroid conditions, for example, just one example, are the most underdiagnosed conditions in women. And that's because, well, we push through, right? We push through fatigue, we push through exhaustion, we push through hair loss. Oh, I can't lose weight right now. Oh, it must be just part of my age or being a woman. And it's a thyroid condition potentially, right?
Mm-hmm.
It gets missed. And then I have hormone therapy at the bottom, not because it's the least important, but as I was saying, just to make sure that nobody jumps to conclusions that it's a magic wand.
Right, absolutely. Yeah. And so just to get back to that, yeah, that thyroid again, how are you moving? How are you sleeping? What are you eating? Impacting your thyroid, which in turn that actually impacts also your sex hormones, right? And so
I mean,
at the end of
I talk about it like it's linear, but it's not, right? Like the
yeah, that was a big realization for me as I started my journey as a health coach is understanding how linked our hormones are. And when you're having conversation about blood sugar, that actually has an impact with your conversation about, estrogen dominance or whatever it is. It's like, oh, they're all those hormones. It's a fine tuning. So no wonder when one is off, the other ones are going to be off. The good news is that there's some big needle movers, the stress hormone, cortisol, insulin, big needle movers, thyroid, that are going to really have also an impact downstream. And so that brings me to hormone therapy. So where should you start, right? So a lot of the documentary, The M Factor, put a lot of emphasis, I think, on hormone replacement therapy. And we started that conversation together that evening. My feeling was that it brought up more questions than answers because it's very confusing. But would you agree that hormone replacement therapy is kind of having a bit of a more of a rebirth right now? Like people were talking about it more. Like, do you think it's becoming more mainstream, more available, more talked about?
think it's ridiculous to talk about it as a rebirth. Hormone
Hmm.
therapy has been around for decades. Yes, it suffered a very bad public relations situation in the early 2000s, but we're 23 years away from that. So we have to park that and really bring back some logic and some critical thinking around menopause hormone therapy. I don't say replacement therapy. The reason I don't say replacement is because we're not actually giving you back hormones like to the levels that you're going to start ovulating again. You're getting a medicinal dose that's going to minimize your symptoms and help you protect against bone loss and symptoms related to genitourinary conditions. So I think that that's really important. I know that there's definitely, more people talking about menopause hormone therapy, and that's a good thing, except We haven't hit the sweet spot
Hmm.
where I feel super confident that anyone that reads my information, gets my script tips, and then goes to see their healthcare professional, that they're going to be met with that same level of education and expertise. We're still in
Hmm.
this time zone where it's going to be hit and miss.
Yeah, maybe we can clarify a little bit for people who don't know about the study, I think it was a 2002 study, and how that kind of set the narrative for 20 years. Do you want to just say a word about that?
For sure. So there's a study that I'm referring to called the Women's Health Initiative Study, and it was launched in the late 90s. The biggest study on women's health, proposed to be the biggest, most ambitious study around women's health in the history of the world. Okay. So this is very good things with very good goals and expectations. And the hypothesis of the study was actually to show that hormone therapy had a positive effect on women's heart health. So they wanted to recruit 30,000 women and give half of them menopause hormone therapy and give the other half placebo and follow them for 30 years. Now, I don't know if any of those numbers are landing for you, but that is huge.
Mhm.
Recruiting 30,000 women and 15,000 of them are going to get placebo, but nobody will know whether or not they're getting something that might protect their heart health. Would you sign up
Mm.
for that? Like,
Not knowing what
no.
I know now, right?
Well, no,
Yeah.
I mean, you just
Yeah.
wouldn't. You'd be like, no, I want
Mm.
what's going to help me, and I don't want to be followed for 30 years and find out I didn't get what, my next door neighbor got. So, anyway, so it was very ambitious. So, instead of changing the parameters of that, they compromised and they settled for, I think it was 3,000 women. So,
Mm.
significantly smaller sample size. And because they couldn't recruit enough women in the 50 years old age bracket, they recruited women who were average age was 63. Okay. So significantly older. And so what happened after a few years after the study began, the researchers started to notice higher rates of breast cancer, higher rates of heart and stroke. Well, guess what? Age is a risk factor for breast
Mhm.
cancer and for heart disease and stroke. But instead of factoring all of that in and
Mm.
knowing that their average age of women in the study were 63, they stopped the study, they pulled it. And then as a result of pulling it, the public relations that was attached to this research episode, I guess, was very poorly done.
Mm.
The train had left the station, the headlines were out, it made the cover of Time magazine, the cover of all the newspapers. This is back in the day when we read the front page of the newspaper. Hormone therapy causes breast cancer. That was the headline. Doctors stopped prescribing it. Women flushed their hormone therapy down the toilet. Then they ended up, suffering from hot flashes. And so they were back in their doctor's office and ended up getting like an enormous amount of prescriptions for antidepressants, which can have a side benefit of treating vasomotor symptoms, but doesn't do anything to treat the root cause, which is, of course, is estrogen and progesterone decline. And
Mhm.
that has lingered. Oh, sorry, there's one more thing I need to say about that before I finish that section off. When the researchers pointed out that this news was incorrect, leading because of what I just explained to you,
The researchers themselves.
the researchers
Mhm.
themselves, because
Right.
they hadn't even had a chance
Mm.
to review all of the data before these headlines hit the
Yeah.
newspaper. But when they wanted to course correct, it never made front page
Mm.
news again. It was reported on the back page. And it never made it, into the curriculum of medical schools for nearly 30 years now, and so on. So anyway, so we've been living with sort of that myth, that scarcity. And we all know how much, breast cancer is such a fear, not just for women, but all of the people who love us, all of our health care professionals.
Mhm.
Like nobody wants to do anything that is going to potentially cause breast cancer. And so we've had sort of this misunderstanding of what even a woman's risk factors are. And it's
Mm.
not, it's not hormone therapy. It's a really good book. that can say what I just said, but so much more eloquently. And it's called Estrogen Matters by Avram Blooming and Carol Tavers.
Thank you for that. We'll definitely put that in the notes so that people can refer to that. But yeah, and I think part of this, the making of this movie and this conversation we're having is part of this wave of, okay, so trying to change the narrative that we've had. But as you say, the hormone therapy has been there, it's been available, it's tried and tested, but it's the narrative around it. And I still have a lot of people around me who have those kind of preconceptions for sure. And then a lot of providers, as you say, might still have those preconceptions as well. So that being said, if I'm having symptoms, I'm not sleeping, or I just say my hair is falling out, or other symptoms. So I go see my provider, and then should I ask for hormone menopause replacement therapy? Like, what do you recommend there?
Yeah, so I provide script tips, not script as a short form for prescription, but script as a conversation
Hmm.
guide that you can use when you go and visit your healthcare provider. And it usually goes something like this. Hi, I'm 56 years old. As you know, I reached menopause 2 years ago. Lately, I've been experiencing sleep disruption, but I've also been doing some reading and investing in my own education. And I've learned that I'm at risk for bone loss in the next, and I plan to live another 44 years. So I'm here today to have an investigative conversation with you about what the potential benefits would be of me taking hormone therapy. Would you help me make that decision?
That's a great script, but what has the response been?
99.7% of the time it works like
Hmm.
a hot damn. And I've had one doctor who said to one of my members, I've been doing this for 27 years. Who are you to come in here and tell me? Right. And that's okay.
Yeah.
Doctors are human. It's hard being a doctor. This exercise of script tips is not about manipulation, it's not about trying to convince. It's
Hmm.
none of that. It's really just about changing, as you said, changing the narrative and also making sure that individuals are preparing for their health conversations. We
Right.
we prepare more for a hair appointment. We do. Look at pictures. We're like, oh, I didn't like this last time. I want to
Hmm.
try this. We sit in the chair. We have the conversation. We set the goal of the
Hmm.
appointment. And we evaluate it at the end. We don't do that with our health appointment.
Yeah, that's so true. That's so true. And I think that's a different way to approach healthcare in general, right? And yeah, just becoming prepared to your appointment. And you find that helps the practitioner too, because, they have their super busy day and an amount of time. And so if you can come prepared and you can make that as efficient and as productive as possible, I think it's also of huge benefit for the provider
They
as well, right?
they
Yeah.
love that. And you know
Mm,
what it benefits? All the other women. And this is an interesting thing. I have big, hairy, audacious goals, Juliet. I mean, sometimes I'm like trying to do way too much, but you can probably imagine, you've probably heard it yourself. A lot of the time, women will say to me, I need to find a new doctor. I need to find
mhm.
another doctor. And I'm like, what about all the women in the waiting room that you just walked by on the way out? Right. So if we want to play a role in changing women's health,
Mm,
actually need to take just a little bit of extra time. And I know it's not possible for 100% of the people, but I bet you there's a lot of us who can do this. And that is sit with the doctor, change the construct of that appointment, and it will change the health for all the other patients that he or she has coming through their office in the days and weeks and years.
right. Absolutely. It's part of that. So presumably that conversation, as you said, it usually has positive outcomes for the women and the others. And so, but once a woman has done that, is like taken the menopause replacement, should she stop there? Or, as we mentioned, there might be some other lifestyle factors that are contributing, right? And it's a bit of a loaded question, but because I have a bias, but as a health coach, but I just wanted to hear what your take was. Yeah.
Yes. Well, again, I mean, we talked about the tool that we both kind of refer to, which is the pyramid. But one of the places that I don't think these conversations have the chance to go to often enough, because we're so busy talking about symptoms and hormone therapy, is that really this umbrella is how long do you want to live? How long do you think you might live? And then what do you want to do now in terms of protecting yourself against the risk factors that are coming down the pipe? So, heart health, brain health, bone health, genitourinary health, sleep health. I should have said that first.
Brain health. Mm.
Yeah. And so it's never, I believe that it should never be one and done, meaning, oh, I did that, I'll be fine. It's kind of needs to be part of an ongoing review process. Our bodies continue to change even once we've reached menopause and we might have experienced, that sudden drop of estrogen. The ovaries are still there and they're still working to a certain degree. And so we might be like, oh, I'm fine. And then 5, 7 years, we're like, now I'm noticing things, right? So, and that came up this morning, actually. I had somebody who said, oh, yeah, no, menopause was no big deal, but now I'm,
Mhm.
really wanting to invest in my future health. So, who should I
Mhm.
go and talk to?
Right. That transition period, again, what are we talking about with menopause? People think it's like just that transition period, but once you're in menopause, you're always in menopause, right? You're in that stage. So things can come up from a metabolic perspective. So there's actually an interesting study that shows that your metabolism doesn't actually decline with age.
Mhm.
It's because of your body composition that your metabolism can decline. And definitely as we head into these years, like there's just some metabolic changes that are going to happen as the estrogen declines. Like our blood sugar is going to get dysregulated, even though we have an advantage versus men before. That's no longer the case. We're going to see our cholesterol rising. All
Yes.
these things. So it's almost like, okay, so those things, your lifestyle potentially mattered less when you were younger because you had all these like buffer and reserves and hormones, etc. But at this point, this is where lifestyles always mattered. But this is where you really have to kind of step up your game in that area. And otherwise, like if you go in there and you do the exact same thing, there's people tell me, I don't know, I used to be able to lose 5 pounds so easily, I just knew what to do. But none of my old tricks are working. It's not working. And it's like, that's because you really have to step up your game in terms of lifestyle. Otherwise, if you stay exactly the same, you are going to see your blood sugar rise. You are going to see your cholesterol go up. And that's going to have an impact on other areas as well, and the heart health, et cetera, and your energy levels. So I don't know if we can equate this to, if my head hurts, I take an Advil, so I take the hormone therapy, but I still haven't solved the reason why my head hurts. Maybe I haven't slept enough, or I'm dehydrated. All these things, like it's back to basics, right?
Another great example, and I'm so glad that you brought up cholesterol, is if I was to go to my doctor, at 62, and my doctor says, oh, Shirley, your
Mm-hmm.
cholesterol's high. You've never had high cholesterol before. We better put you on a cholesterol
Mm-hmm.
medicine or a statin or whatever. And it seems always like this, that's a surprise, but we have a
Yeah.
problem. So let's fix it. And we've got just the thing to fix it. And I am totally pro cholesterol medication and statin. If you need it, you should do that. But we are not connecting the dots with women's health to say when cycles are regular, estrogen protects the heart. When somebody reaches menopause and estrogen declines, cholesterol and blood pressure go up. We should be saying, why is heart disease and stroke the number one killer?
Right. It's a certainty. It's something that's going to happen, all things being equal. I think for a lot of people, that's exactly the experience they have. Like you go in and all of a sudden, I'll give you myself as an example. I did a checkup maybe last year and I hadn't done one for 2 or 3 years. And all of a sudden, boom, the cholesterol had bumped up. And so had the blood sugar. And I said, oh, I should do something about this because it's a trend. It's going up. Like she's like, no, don't worry about it. You haven't hit that level yet that we would have to
Right.
treat it with statins. But I'm thinking, wait, hold on. If this is a trend, like it's just going to continue going up. So I need to get a handle on this because in a way, we're kind of waiting for it to hit those numbers. Same thing with blood sugar. You get to that pre-diabetes, you can be offered metformin or other types of medications, but there's so much we can do knowing that's the direction we're going in because that's just the life
Yeah.
stage our body is in, right?
Yeah.
Absolutely.
I don't know if you've heard some of my stuff, but I do a lot of analogies with cars.
Yeah. Okay. Go
Is-
ahead.
Well, just because, as you're talking there, I'm thinking we treat our vehicles so differently, right?
Hmm.
And if you buy a car and you plan to drive it for 300,000 kilometers, then at 150,000 kilometers, midway, you're going to be like, okay, I got to get new tires. I've got to get new brakes. Got to do this because if I don't, this car won't carry me safely for the second half of its life. And that's kind of the same thing we're saying here.
Yeah, exactly. But that does take a bit of a mind shift change. The paradigm's a little different. It is about like empowering yourself and realizing, okay, I'm the owner of this car. So the burden's on me to take care of it in a way that's going to make it last, right? So yeah, so apart from the hormone replacement therapy questions, like where would people go to get good quality sources of information? Like if I'm wondering, for example, say somebody, I think somebody had mentioned this at the panel during the event. What if you have a history? Somebody has maybe a history of breast cancer or somebody in their family, or they're just a little bit more concerned. They don't want the general information. What would be the steps to then kind of investigate their particular risk level?
Yeah, so I think that like baseline is everybody wants and needs the general information
Yeah.
at every age and stage, whatever is applicable, and then being able to tell your story in a way that's going to lead you to the clarity and the list of menu options that you have. I think that that is really the steps or the analogy that's often missing for individuals who are like, maybe they make up decisions on their own. Maybe they sit at home and they're like, oh, well, I guess hormone therapy is not for me. Or, my mom's sister's aunt's cousin had breast cancer, so I must, be at risk. And they're not like instead diving in and saying, what are the risk factors? And beyond getting that quality information and basic general information, how can I take this information to an expert who can help me sort out what it means for me? That's the biggest light bulb that I have with members.
At the end of the day, you can hear all this information, but it's really an individual case and individual risk
Con
assessment.
the
And yeah.
conversation, that individual benefits versus risk assessment, and
Hmm.
that personalized conversation with a healthcare professional, it brings together the science, but also the clarification of if this, then that. I say that a lot. I had someone this morning. So she messaged me, how can I advocate for a hysterectomy with my doctor? I don't want to be dismissed. And I was like, okay, well, let's back up 3 steps, first of all, because I want her to understand that while she thinks that might be the best solution, does she realize that once the uterus is removed, that she is more susceptible to incontinence and pelvic organ prolapse? And, will she put all of those things in place too, if that is the decision that is made? And has she sat with her healthcare professional and talked about that? Might be step 3, but what is the number 1 choice or the number 2 choice? Did they weigh the pros and cons?
Yeah, you can go too far the other way.
I'm
You
not
still,
analytical,
yeah,
but this
yeah,
really always stretches
right.
my muscles in my brain because
Mm,
I just do not want us, A, making assumptions, and
mm,
B, regretting.
right.
So many assumptions that, oh, I just have to do this and I'll be fine.
Right. And and the fact is that outside the conventional medical system, but there is a whole other area of medicine where you have a lot of options in terms of hormone testing or, looking at your genes, for example, right? In terms of like looking how you detox estrogen. The particular test I'm thinking about is the Dutch test. We haven't spoken about it. I don't know what you think about it, but in terms of looking at, what are the detoxification pathways for estrogen, and are you having more risk factors because those pathways are more prevalent for you? You can make it a lot more individualized,
Yeah.
I guess. Yeah,
Yeah.
looking at your own
I made a
perspective. So,
face there when you mentioned
yeah, I know,
testing.
I saw.
No, I should clarify. Hormone testing exists for a reason, right? So thyroid, we need to test that.
Right.
Sometimes cortisol, vitamin D, for sure. I just need to clarify that hormone testing is not necessary for everyone across the board.
Right.
And so I don't want anyone listening to think, oh, I need hormone testing and I need to spend money. And that's not the case. But we do need to understand that those tests do exist for a reason, and they do provide value to people that have, like you said, these special cases, right?
Right.
My
Right.
sister, for example, reached menopause when she was 36. She needed hormone testing to determine her pathway. She's now a healthy 68-year-old. But my daughter has PCOS, so she had hormone testing when she was 17. So you don't want to like dismiss or throw out the baby with the bathwater and say nobody needs to have their hormones tested. That's not true, but not everybody needs to either.
Right, exactly. But if you're on those cases where you're like, I feel like I have a particular risk factor as it relates to estrogen dominance and potential cancer risk, what I'm saying that there are steps that you can take if you want to go a little bit deeper into your personal risk assessment, not saying that it's a necessity. The fact is, if you're having symptoms, as of sort of 35, 40, pretty much you're going to be in perimenopause. If your cycles are irregular at a certain age, you don't have to test your hormones to know that your hormones are getting irregular, because that is a normal, I'm saying it's a normal part of the body's evolution, I guess. Yeah. Okay. So maybe to kind of close it off here, I don't know if you remember back to November when we watched the movie, what wasn't part of that conversation? Like, I think we talked about some of those things today, but is there anything else that you feel like we haven't touched on that you think should be part of the conversation, or that any woman should be aware of right now?
As it relates to the documentary?
Or you see the conversations that you're having, is there anything else there that we haven't touched on?
Yeah, so the documentary was okay. I love the people in it. I thought it was well cast. I love them because I know them and I revere their work and have read their research and all, they have great platforms. So all of that was amazing. I think that like listeners to this conversation need to be aware that there is going to be a whole lot of tools available to you, right? So there's going to be books and podcasts and documentaries, and that's great. And you have to pick what's best for you. What I was really disappointed in with the documentary, or disappointing isn't even the right word, leery might be a better word, was that I think audience members at the consumer level would walk in and think, today's the day. Juliet's having an event. I'm going and I am going to walk out of here with the answers I
Mm,
need. And I don't think there was a single soul, unless they really took advantage of the panelists, which was amazing and really necessary for a documentary like that. But I don't think there's a single soul that can watch that documentary and go, now I know
mm,
what I need to know about perimenopause and postmenopause. And the information was presented in somewhat of a back and forth manner. They tried to cover off a lot of topics, such as menopause education in the workplace and diversity, right? And how that needs to be factored into
mhm,
this conversation. There was testosterone, but a lot of talk about testosterone and probably not enough that would give, the 49-year-old, like just really now wanting to address her health and address her vasomotor symptoms, the next two steps that she needs to take this process. And if she shows up at her doctor's office tomorrow saying, I'm here to get a prescription for testosterone, which is not currently approved in North America in the treatment of women, she's going to leave disappointed. And that will set us back. And we don't want to do that. I want to
yeah.
keep moving the train forward with, as many next step logical resources that we can do. So, and I recognize adults all learn differently. So it's great that we have this content available to us. But I found in the work that I do is that all of the information needs an interpreter more often than not.
Right. So a lot of questions raised versus answers, but a great conversation opener nonetheless, right?
Exactly.
Because we had this
Yeah.
conversation, but then that's where, there are people like you doing amazing work in this space, providing, closing that knowledge gap, being a resource for women, et cetera. So I'd love for people to know where they can access your community and ask you all those questions. I'm sure people are gonna be like, okay, I got to ask Lee this. So where do they go?
Absolutely. So menopausechicks.com is my website, and there's a library of articles there. And then I spend most of my time at menopausecommunity.com, which is currently a private Facebook community where women can learn from others and get the shortest distance between where they are now and evidence-based information and what that means for them.
Awesome. And so can anybody sign up?
Yeah,
Yeah,
sure.
there's no application process.
It's free.
Okay, awesome. And do you have any big events or anything coming up that you'd love to mention, or?
Oh gosh, I'm
Mhm,
barely finding my sea legs for 2025.
mhm,
I've got some big plans. I've got some free events. I've got a session on, it's called Perimenopause Primer and Postmenopause Plan. And then I've got a series of six that are coming up where we're going to do some of the deep diving that you and I talked about. We're going to go into the impact of alcohol. I've got a special session for women over 60 because I find that
mm,
that's a huge demand. And of course, the vagina dialogue dialogues, which I love to talk about vulva and vaginal health. So,
Awesome. All right. Well, listen, looking forward to staying in touch this year and to continue the
yeah,
conversation.
the
Continue. It's been
conversations are
cracked
totally
open.
cracked open.
We're continuing it, we're expanding it, we're deepening it.
Now we're
And so,
hatching a health plan for everybody.
right, exactly. And so it's such a pleasure to chat with you today. And we'll speak soon. Yeah.
Okay, thanks.
Thanks.